claiming that they've done more harm than good and are attracting more drug users to the area. Joining us now from Philadelphia is Sarah Laurel. She's the executive director of Savage Sisters. Sarah, good to see you and good to have you here. Just really briefly, if you can, just for our viewers and audience who aren't familiar with you, how do you actually get in there and help some of these users that we just heard from?
Specifically at our drop-in center in Kensington, we offer showers and wound care, and we do street cleanups and reverse overdoses that happen within the public.
Okay, Sarah, obviously you guys are getting a lot of pushback now as Philadelphia tries to clean up the area, specifically from some of the council members. I want to pull up this quote from the Kensington caucus that are slamming these prevention centers. They say families live here. Children walk these streets every day to get to school, and Kensington is their home. They did not ask for this, and they deserve better. The neighborhood can no longer be the home of an open-air drug market, nor organizations that encourage the market to thrive. What do you think of that, where some of these council members are saying that organizations like yours are actually attracting these folks?
I think it's a scapegoat. The open-air drug market has been there for a very long time, and the work that Savage Sisters does is in response to the toxic drug supply. We offer showers and wound care, and the other harm reduction organizations are offering public health services that serve the community and promote health and wellness. They lower infectious diseases spreading throughout the community, and they, alleviate some of the numbers of people going to hospitals and situations like that. So we save the city millions of dollars by offering street medicine, and we're responding to the toxic drug market.
Right. And, the mayor's office, just want to point out, hasn't commented on this. Fox News reached out for a comment, and they haven't yet. But Mayor Parker, I believe as recent as just last month, suggested bringing in the National Guard to Kensington to try to clean up the area. What would that actually do to some of these people who desperately need help?
They did that in 2020. I live in Kensington as well as a resident, and the National Guard cannot interfere on these kinds of issues. They cannot do that. The local police are going to have to be the ones that take the lead here, and I think it's really unfair to put this burden. It's social work and harm reduction and public health work. This burden does not belong to the police or law enforcement.
And just really quickly to just wrap this up here, you obviously can't do this all alone. So what is the solution? What would you just say to the mayor, to not only keep you there, but to hopefully get some more help for organizations like yours?
Myself and other harm reduction organizations would like a promise that services will not be suspended. These public health services are vital to the community's health. And we would also like to be brought to the table. We've all been doing this work for years. We are members of the community, and we think that we are uniquely qualified to serve and help this program. If she wants to do enforcement going forward, we would like to be a part of that plan so that we can make sure it's done person-centered, compassionately, and using evidence-based practices.
Yeah, I can tell that you have a heart for this, that this is a life passion of yours, and so we'll see if Philadelphia allows you to stay and continue your work. Sarah Laurel, thanks for joining us.